The last thing, we were talking about this a little earlier, is to go to a child's pose to kind of help relax all those discs and muscles again after you've stretched them a bit. So if you've got a good core, you tighten the abs, you bring it up all the way back. One of the nice things about this one that I like to do is to just let the chest just drop, and you'll feel really nice pull right through here. And it also is kind of opening those discs up a little bit as well. This one, I would say you do also want to be a little careful with. If you've got a bulging disc that's really angry at you, this one, it might feel good in the beginning, but if you're feeling twinges or it's a bit sore, you want to hold off on this one. This one would be if you got a little bit more of a stable spine, like most of these stretches. Everything that we're talking about is for the sore back. But if you've been diagnosed with a fully ruptured disc, if you're having paralysis or shooting pains down the leg, you really should be seeing a professional and consulting which levels of these is okay for you to do. Okay, that's really, really important. But otherwise, a combination of going from a Sphinx back to a child's pose, and then you can go back and forth. You know, you can go back to the Sphinx again for another 10 to 15 seconds or 20 seconds, and then pulling it back to the child's pose. You go back between these two. Another nice benefit of doing them in combination is it's putting motion in those joints, you know, keeping fluidity and fluid pulsing through the discs and in the joints. Great thing for your spinal health. So remember, try these out, see how they are. If you're not seeing a professional, if you're at a level where you're having pain, I would recommend consulting myself, Shane, someone in your area. But otherwise, if we've given you these recommendations, they're a great way to start to open up your spine a bit.